Hi,
Hello.
my name is Ariel, and I'll be doing your intake interview today. So why don't you start out by telling me why you're here?
My name is Courtney, and I'm here because I have anxiety, and am experiencing a lot of anxiety flare-ups due to starting a new job and starting graduate school.
Oh, really? That must be tough.
It's it's a lot. It's a lot of stuff. My new job has not been very cooperative with my school schedule. And so for the past couple of weeks, I've been like running on like E and only taking like increment naps.
Oh,
And
wow.
I have like trouble sleeping. Like I take medicine to make me go to sleep at night, and so like the naps are not cutting it, and I feel like I'm gonna fall asleep at work, and then I don't have time to do my homework, so that's stressing me out too. So it's just been a lot of stuff, and they're not. They hired me for weekend nights, and then they told me they didn't have anybody that could train me for weekends. So they're making me come in during the week.
And that's not helpful.
No.
No.
And so it's been absolutely miserable. But I keep telling myself I can do anything for like 2 or 3 weeks, and then
Go from there.
Yeah.
If you have to. That sounds like a hard balance.
it's very very hard. I'm a planner to like the nth degree, so like I have everything mapped out. I have my sleep schedule mapped out about how many hours I'm gonna get and different nap times and when I'm gonna eat
Oh,
and
wow.
everything. And so my husband's been really great the past little bit because he works weekends. So during the week he's been doing a lot of the stuff because we have like a ton of animals. So he's been taking care of them and doing that, and while I've been sleeping. So I'm really thankful for that because that's helped. That's helped a lot. I don't think I could do it without him helping me.
Well, that's good. So you feel like he's supportive
Oh
of
yeah.
what you do.
Oh yeah, definitely. He tries really hard. Sometimes sometimes I still feel like I'm taking care of him even though he's trying to take care of me, but he tries real hard. So
Oh, well, that's good. It's good that you have someone there for you.
yeah, but no, so it's just been crazy. So and last night I had to work on a geriatric unit, and I'm not very comfortable with geriatrics, and that was really really hard for me last night. So emotionally like drained from doing that. So that's something that I'm not looking forward to in my new job. But they told me I wouldn't get pulled on that unit because I work in a psychiatric hospital. So,
Okay.
but yeah, so that was hard. That was really tough for me last night. But
Yeah, that sounds like that could be a very emotionally draining and stressful environment, especially if you're doing grad school.
yeah, one of my classes, I feel like I don't have time to do all the homework and retain everything that they're trying to tell me. And I feel like everybody else is, and I feel like I'm not, and I feel like everybody's looking at me like I'm an idiot. So that's really stressing me out because I don't know if everybody else is just playing that they understand what's going on, or if everybody else really just understands what's going on and I don't.
Well, you never know. I mean, it can be hard.
Yeah.
I mean, like even if it seems like they might be judging you, I mean, we sometimes we can just get like so caught up in our head and like thinking that that gets projected on the other people. So I mean, your like worries and anxieties, like other people probably aren't paying. Like yeah, they might look like they know what they're doing, but you never know. I mean,
Yeah, that's what I tell myself because I'm like a really outgoing person. So like I like when I get really insecure, I just tell myself that I'm probably asking the questions that everybody else is too scared to ask, kind of thing. So like I don't like let myself feel too bad about it because I'm like I'd rather look dumb and then know and then instead of just sitting there and not knowing and then not learning anything. So
yeah, because you never know. They might just be sitting there like, oh, it's fine.
Yeah, I
I'll
mean,
just be waiting.
and the professor doesn't care, that I ask a ton of questions. So, I mean, if it gets to be a problem, I'm sure he'll.
Yeah, he'll let you know.
So, but there's just so much to do every week. There's like literally like 3 or 4 assignments due every single week.
Oh, wow.
And it's just like, I don't know how and it's not like reading assignments. It's like you gotta video stuff, you gotta test stuff, it's insane. I mean,
Wow.
it's like I don't even get to focus on my other classes and do like the reading and stuff like I'm supposed to, because all of my time is spent on that one class, and it's just really frustrating and unrealistic because I feel like it's just too much. I don't know if they need to make it like a 2-part, so like
Right.
part 1 is first semester, part 2 second semester or something,
Right.
but it's way too much, and I'm just worried that I'm going to focus all my time on that class, and then I'm not going to do well in my other classes. But it's like you got to pick and choose like what you're
Right.
gonna.
What you're gonna read, what you're gonna finish.
So
That's tough.
yeah, it's been really, and like all the volunteers and stuff. Like I'm not like originally from Louisville. Like I'm from Casey County, and I went to school in Columbia, which are both like an hour and a half, 2 hours away. So all the people that I can get to volunteer live like an hour and a half to 2 hours away. So like for the test and the interview and all that stuff, like I've got to drive to meet them, because I mean they're volunteering. So I mean I'm not
Right.
gonna be like, I want you to volunteer and come to me. You know what I'm
Right,
saying? Like
yeah.
that would be kind of rude. So
Right.
and then it's like I have to put extra time into my schedule because I have to account for that drive time just to be
Right.
able to get to them to do the assignment.
Right.
Whereas everybody else is like driving like 10 minutes or meeting people on
Right.
campus. So that's something that's really overwhelming. I'm sorry, I'm really sleepy.
Well, I'm sure with everything going on, it sounds like you're only taking, a little bit of time each day to sleep, which
Yeah.
which isn't good.
No.
For your physical health, your emotional health.
No, and it's not something that I plan on doing long term. So I have to do it for the next next 2 or 3 weeks, and then I should be on a very like normal schedule. But it's just like right now for this last little bit, I just feel like I'm drowning in stuff to do, and it's just. I actually work 2 jobs, but one's like super part time, super casual, and so.
Okay.
This week I had to speak at a mental health symposium at our hospital, and I didn't have any of my stuff together, so I was like rushing and trying to get all that done, and then like doing visits with the dog, because I do pet therapy, so I take the therapy dogs to see patients, and it's just, and sometimes like I have really good days at that job, and then some days it's like emotionally like exhausting, because like some days I go on the psych unit or different things like that, but then some days I go and see like terminal people and hospice people and people with cancer and tubes everywhere, and they're dying and they're in pain, and it's a lot to process and have to be.
It's a lot to take on.
Yeah, and you see their families, and their families are so distressed, and you're trying to keep that face because you're in there to bring comfort to them, so you can't cry with them, but like you really want to cry with them because
Right.
I mean their loved one is dying and they're in pain, and I just get really frustrated with it. And then my boss is a super super sweet lady, but she's an ordained minister, and so like she doesn't really she's so used to seeing that stuff that she doesn't really understand that it's hard for me.
Right.
And so like no one really processes those things through with me, so I'm just like left to go home and like process them by myself, which is really frustrating. But I mean, I enjoy it, and I do enjoy taking the dog to see people, but I just don't really enjoy the hospice and the end of life. Like that really sucks the emotions out of me, and that's why I don't really like the geriatrics unit, because it is emotionally draining, and I feel like I feel like everything's just like sucking me dry right now, and I don't know what I'm gonna do. I mean, I know I'm gonna do it, and I know I'm gonna, but like I just feel like I can't do it.
Well, Well, you said that your supervisor isn't someone that you can really process those emotions with, but do you have anyone else in your life that you might be able to?
My husband is a nurse, so I'll come home and I'll talk to him about it, but he doesn't really understand either because, I mean, he's a nurse on a step-down critical care unit, so he deals with people dying,
All the time.
and so, like, he listens and he's really empathetic, but it's just not something that he really understands either because he's so numb. I mean, I don't want to say numb, but desensitized to
Right.
to all of that. That it's normal for him too. So it's kind of hard because I'm a big feeler and I'm really like I'm a really emotional person, and so like that makes me even more exhausted than I already am because not only am I like doing stuff like crazy, but then I'm like got all these people with all these problems, and I'm trying my best to help them and trying to help, and then it's just like just sucking me, just like I don't know how to describe it, but
It's like you're giving. I mean, you're giving so much emotion. Even I mean, even if they're not like actively asking for it, like you're there, you're emotionally invested.
I am,
and it's hard for you to step back from that.
I'm a big feeler. Like I'm very like I'm a really good like I feel like I'm a really good like judge of character, and I feel like I am able like to really connect with people, which is a blessing and a curse because I'm really good at connecting with people, and I feel like I'm therapeutic, but at the same time it's like I put that boundary up, and I understand that it's like a professional relationship, but like I just feel like I connect to people like on such a level that like it takes a lot out of me because I'm so like in it with them, like with family, with I just feel like with work and everything, like I like if I'm in it, like I'm emotionally I'm in it, and I feel like I pick up on stuff a lot of times that people don't pick up on, and I'll be like, did you know this so and so, or well this one, and everybody's like, oh well, I don't know, because like I feel like that's part of like the territory of being in like the psychology field is like you pick up on all those things
and little things,
and you're like, okay, well this person might have like this disorder, this person might be going through this, or like where everybody else will be like somebody be like, oh I'm fine, or I'm doing good, and like I'm looking at them and I'm like, you are not doing good, you are not fine, like you're depressed, you're you're anxious, you're like whatever, and like I feel like everybody else just kind of gets to go through life with these blinders, and it's not that they don't care, they're not in tune, and where I'm like, you're not okay. Okay, tell me why you're okay. So I feel like I'm the person that everybody just like verbal vomits everything on because it's like, which I mean, I bring it on myself because I continue to ask. But I mean, I feel like if I don't ask, like other people might not ask them. You know what I'm saying?
Yeah.
If I was in their shoes, I would want somebody to talk to me.
Right.
So, and it's hard too because sometimes, I mean, working in a psych hospital and working in the regular hospital, you have to help people confront things sometimes, and you kind of have those come to Jesus meetings with them, and that comes with like a lot of hostility and resentment and then sadness, and then and so it's like you have to be there for that and be like, look, like I love you as a person, but like this is not gonna work, like we have got to and then you just go up and down on that roller coaster with that person, so it's really
that's a tough role to be in.
Yeah, it's a lot. It really is a lot. Which I mean, I enjoy it. I really do.
Right.
And when I get enough rest and I'm not being super overwhelmed, like I like that kind of stuff. But the past couple weeks, it's just been like too much, too much all at one time, and I feel like nobody is wanting to help like carry the weight. Like because I'll tell like I've been at work and I've been telling them I'm like, y'all, I'm exhausted. Like I don't feel like I can do this. Like da 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 da, and they're like, well, tough. Like here you go, and they're just like throwing more stuff at me, and I'm like, I'm drowning. Like I don't need to be doing stuff with patients. Like I'm not safe to be doing stuff with patients. I don't feel comfortable doing this stuff. I don't like this. Like this is people's lives, and like I don't like I'm so tired right now. Like normally I would feel comfortable, but I'm like I don't like I don't want to miss something. And that causes like the anxiety too, because like I'm like hyper vigilant because I don't want to miss something, because like when when you work in the psych hospital, you have to do 15-minute rounds. You know, you have to make sure they're breathing and everything. But it's like, are they breathing? Are they not breathing? Did their
Right.
chest just rise? Did their chest just fall? It's like, you know, and it's like,
Right.
it just makes me anxious. Like, because last night I was working, and while I was doing rounds, one patient snuck out of her room behind my back and got into the patient's bathroom.
Oh wow, that's not good.
I heard the door click, and I opened the door, and I looked in, and the gentleman whose room it was, he was laying in the bed asleep. So then I went and I continued my rounds, and then I noticed there was somebody missing. So I yelled down the hallway, and I went to look for her. I did not even see her in his bathroom because their lights weren't on.
Oh,
I
wow.
completely missed her. She could have been in there hurting herself. She could have been
Right.
in there doing anything. And I did not notice her because I was not with it enough.
That's scary. I can see where that would be.
And that
Yeah.
absolutely terrified me.
Yeah.
Which, granted, it only took me like 2 or 3 minutes to be like, okay, she's not in
Right.
her room, you know. And then we really started like thoroughly searching, and that's when we pulled the curtain back. And
Right.
But I mean, like normally,
yeah.
I would have noticed that. I would have
Right.
noticed that there was somebody sitting on the toilet. Of all things, she was sitting on the toilet with the shower curtain pulled open. She just didn't have the light on,
Right.
so I didn't notice that she was there. And I was like, oh my god, she could have killed herself. She literally could have killed herself in like the 3 minutes that it took us to find her.
Right. And you put that on. You put that weight on
Yeah.
yourself.
Yeah. I mean,
Right.
because I was doing rounds, so it was my responsibility to check on Area 15. And honestly, like, I know it's something that could happen to anybody. Like,
Right.
even if you're, like, paying super attention and like, I know it happens, but, like, that really upset me because I,
Right.
like, take that really seriously because, like,
Right.
if it was my loved one, I would want somebody to take it that seriously.
Right.
And I feel like a lot of people don't. Like, the nurse and the other aide were just like, oh, it's okay. Come on, honey. Go back to your room. I'm like,
Yeah.
she could have been sneaking in there. She could have assaulted him. She could have, like, shamed him with something.
Right.
She could have crawled in bed and tried to do, you know, because, like, I was on geriatrics, so a lot of times, like, they're, like, back in, like, their teenage years and they don't know what they're doing.
Right.
And, you know, and it's, like, anything could have happened. Like, and then I was upset because I'm like, you all aren't upset about this. Like,
It sounds like it's not a supportive environment for someone like you.
no, because I don't feel like everybody else takes it quite as seriously as I do.
Right.
That facility is really laid back, which is good in certain aspects, but it's
Mhm.
also really awful in certain aspects. So, like,
Right.
I've got to adjust to that and, like, lower my expectations, which is kind of hard. Like, and be like,
Right.
Courtney, you can't change the whole freaking thing. Like, it's a job.
Right.
You just go in, you do the best you can do, and you go home. And, like,
Right.
I've got to make myself do that. And that's something that's hard for me, and it's something that I'm working on, but it's definitely something that I've got to be like, you cannot, you do what you can, and then
Right.
you leave. Like, you can't save everyone, you
Right.
can't fix everything, like, you can't, like, you just can't. And that's something that's hard for me because I want, like, to be able to,
Right.
but it's like you have to just take your wins when you get your wins, and you just learn from the stuff when it, you know, bad things
Right.
happen, and you just do the best you can. And so that's. But last night I dreamed about like I had nightmares about like running around the unit, like
Oh, wow.
chasing her, like trying to find her, like when I came home and like went to bed.
Do you have nightmares pretty frequently?
Yeah, usually they don't make a lick of sense though.
Hmm.
Like, it's the most my sleep and my dreams are the most bizarre thing ever. So, like, I lucid dream a lot, and it's like somebody will be attacking me or killing me or whatever in my dream, and it's like I know it's fake, but yeah, I still have like that paralyzing fear,
Right.
like in the dream.
Right.
But I'm like, why am I afraid? Because this isn't real.
Right.
And or I will dream that I'm dreaming a lot, which is completely bizarre. And everybody's like, you can't do that. And I'm like, no, you can. It happens all the time. And then too, like, people in my dreams, like, I've done this ever since I was a kid, and I don't understand why, but like, say I'll be talking to my mom in my dream, and it'll be my mom's voice, but it won't be my mom. It'll be some random person.
Huh.
But there are people and the voices and it'll be somebody that I don't recognize, and it's almost always like that.
Huh.
And they don't make any sense, like, cause like the nightmares may not mean that it's like something scary's happened,
Right.
Like, it may mean that I'm walking through this library and I just get like a crippling like fear of anxiety and I wake up hyperventilating. So like nightmares don't always mean like there's something like scary or bad happening.
Right.
Like it's just that feeling that I get when I wake up where I'll dream that I get hurt and I'll wake up in pain. Like one night, like I dreamed I broke my leg and I woke up like clenching, like holding my leg.
Well, they do say that your dreams are sort of are a manifestation of like the stressors and your experiences in life. So it sounds like your anxieties are sort of playing out in your dreams and nightmares.
Yeah, sometimes they do make sense. Like last night, like that was like directly related to.
Right.
But like and even if I don't have nightmares, I dream almost every night, and I can tell you what I dreamed about. And a lot of times they don't make sense, even if it's not a nightmare. Like I dream constantly, so like I sleep, but I don't rest.
You
and
don't
even
rest.
with the medicine, it helps some, but it's still not enough.
Because you're just worked up constantly. Emotionally, you have that anxiety and that stress. So maybe when you sleep and you lay down, like your body just can't find a way to relax itself. Yeah.
And I try to be like really proactive, like with myself. Like I have like a journal, like that like gives you prompts. Like if you have anxiety and like you fill a journal out, or you know, like I've got like the meditation apps before and done the breathing exercises, and
You're still there.
Yeah, and I don't know what else I'm supposed to do. You know what I'm saying? Because I've tried all the things and I'm on medicine and it's like, it helps. Like it's definitely improved from where it was, but it's like we're only halfway there and I don't know how to, which I guess, honestly, I probably won't ever be quote unquote like normal with like resting and sleeping and stuff. So I guess this is my normal. It's the best that I'm gonna get, but it doesn't make it any less less exhausting because like I'm getting the naps and I'm getting the stuff, but it's like
you're not getting that restful state.
So it's, I don't know. A lot of my problems stem from my sleep because I have anxiety, but my anxiety gets worse when I don't rest, and it just like loops around all the time. So a lot of time, I know that about myself, and that's kind of one of those things that's frustrating because you can't fix it. You can't really make it go away. You just gotta learn to deal with it. And so, but adding graduate school on top, because like I was like, when I was in my undergrad, I did my bachelor's in 2.5 years. I took like 18 credit hours like every semester, and did it and still had time, worked full time, and did practicum like during that.
Wow.
And so I was like, graduate school, I got this. And I got it. Like I did all the things in my, in my undergrad. Like I got this.
Right.
And now I'm only taking 4 classes, and I feel like that it's literally all I can do to just, I feel behind. I feel like I feel like that one class is literally taking all the time that the 6 classes in my undergrad took for the one class.
Right.
And then the rest of them is like, oh, if I have a free 30 minutes, I'll read the chapter.
Right.
But if nothing's due, it's like not a priority.
Right.
And that's really not.
That's not good.
No.
Because if you set those standards now, you might never go out of it.
Yeah, but it's really frustrating. And like I felt I didn't even have time like when I wasn't doing orientation for this job, like to get it all done. Like I had more time, but like I still don't feel like I had enough time to do it because this one class has just got it's the expectations because it's got a lab and the professor's part isn't bad, but the TA is not specific and she does not set clear expectations. And I'm one of those people. I want you to tell me what you want, and you will get exactly what you ask for.
Right.
Do not look at me and be like, well, read the book and interpret this and just do the best you can. I cannot stand that. It drives me insane. So like I get really frustrated because I'll just be looking at this stuff and I'll just start like crying because I'm like, I don't know what she wants. Like, because she won't just tell me
Right.
what she wants. And it's like something will be due this week, and then it's like, oh well, we didn't go over that, so we'll do that next week. Or oh, this is still due. I know I didn't teach you about it, so I'll grade you easy. It's like, why?
Right.
And that's adding to my anxiety, but that's also something I can't control.
Right.
I'm trying to like roll with the punches and stuff, and like honestly, like I'm proud of myself because I do a lot better with it now than I did like when I was an undergrad.
Right.
But I mean, still, like there's that part of me that's like hardwired like that. It's always gonna be like that. You know what I'm saying?
Yeah.
So like it's really frustrating for me when it's like, well, I'm gonna do it this way, I'm gonna do it that way, and it's like,
Right.
it's like
There's no consistency there.
no,
Which is tough.
yeah, because this is the real deal.
Right.
I mean, this is like you had to interview, you had to apply, you had
Right.
to do all the stuff to get here. Like this is the real deal. You know, like you
Right.
can't. I'm like you can't fuck it up. You
Right.
know, like you can't.
Yeah, this is your future career.
Yeah,
Yeah.
like this is serious, and I want to make sure that I do everything for this because like this is something that I love and like this
Right.
is something I'm really passionate about.
Right.
Because I never thought that I would get here. I thought that I would get a master's in mental health counseling, and that would be like
That
as
would
far
be
as it went. I never thought that I would have like a doctorate in clinical psych. I didn't think I was smart enough to get a doctorate in clinical psych.
Right.
I wasn't even gonna apply, but one of my professors like pushed me and pushed me and pushed me to do it. Just, you know, so I
Right.
did. So it's like I don't want to let myself down, you know,
Right.
because
You set such high expectations for yourself.
yeah. But I mean, I just like I'm proud of myself because I
Mhm.
got here, and like
Right.
I didn't think that I would get here.
Right.
But it's like now that I'm here, like I want to do everything right because I want to prove to myself that like I do belong here
Right.
because I don't feel like I belong.
I'm sure other people feel that way too.
Yeah, because they talk about the imposter syndrome and people like, especially in graduate programs and stuff, feel like that. And I know it's like a normal thing,
Mhm.
but like it's still something that like I really struggle with because I'm like I don't deserve to be here. Like there must have been a fluke in the system, like or
Right.
like I got through and now everybody thinks I'm an idiot and they regret it and they don't
Right.
like they wish they would have picked somebody else, and so it's just like that causes a lot of anxiety for me because
Right.
I feel like I'm not like good enough to be here, even though they repeatedly tell me that.
Right.
They're like, we picked everybody that's here for a
Right.
reason, and I'm like, but did you?
Right.
You know, because
Yeah,
I'm like,
that's tough.
why did you like?
Right. Because they tell you, but you have to accept it for yourself.
Yeah, I have zero self-esteem, so
That's tough.
absolute like rock bottom zero self-esteem. So, but yeah, then that's something that I'm also working on right now. Is like I value myself as a
Mhm.
person. Like I understand that like I am and like I'm important and like I matter and that my husband loves me and that my parents love me, and but just like I struggle a lot with like body image like problems,
Mhm.
and that feeds into the anxiety too, and so that's something that I'm trying to work
on.
through right now because I mean I don't have time to like exercise and diet and you know whatever
Right.
like all that stuff like while I'm here, and like I don't have time to get ready and like do my makeup every day and you know and all that stuff, so it's like really hard, and that's something that I was doing really well with. Actually, I was really proud of myself.
Mhm.
And then I'm gonna be my grandma's wedding. I'm a bridesmaid. I went to try on dresses, and
Mhm.
my grandma and her sisters kept bringing me dresses that were too small. And I finally looked at them in the middle of the store, and I wasn't upset about the fact. I just said, my quote unquote words were, my ass is too fat to fit in this dress. Like,
Mm.
bring me something that fits. And they looked at me and they were like, oh honey, it's okay. Don't be upset because you're in a plus size or you're in a bigger size. And I'm like, I wasn't upset
Right. Until
you said that. I was
Right.
just telling you, like, these don't fit. Like, quit bringing me, like, size 6s. Like, it is evident I'm not a size 6. Like, that's fine. I'm
Right.
okay with that. But, like, just stop. Because,
Right.
like, the more you bring them to me, then it's going to make me feel bad. Because I'm
Right.
like, I can't wear this. I can't wear that. You know, so, like, just
Right,
bring
yeah.
me something that's going to be in my size.
Right.
And then, like, they patronized me.
Right.
And it was almost like they made a stab. at me because like my grandma's sister is like really petite and like she can wear like a size 4 or a size 6 or whatever, and it's like honestly I feel sorry for you because you have nothing better to do with your life and you're like 60 something years old than like diet and worry about how you look. But
right.
you know what I'm saying? And
Yeah.
it's like she kind of like made it like a little stab at me, and then now I'm like I don't want to say relapse because I guess that's not the right word, but like I've fallen back into that cycle. And I see myself checking mirrors, and I see myself, you know, and I'm just like, I'm back in that cycle, and that's something that I've got to try to break, because I mean, like, it's to the point that like I will get like upset and not want to come to school or not want to like go out in public because I'm like, I look like fucking shit, and I don't want to be here, and I don't want to do this, and I don't want to do that. And I'm like, that, Courtney, that's absolutely ridiculous. And, like, I know that's ridiculous because, like, I'm in a psych program. I know. And that's, like, what's even more frustrating is because I understand how all these things work, but yet I still can't manage to control all those emotions in myself.
Right.
Which is really, really frustrating because it's like, I know what I'm supposed to be doing, but I'm not doing it.
Yeah.
And then I'm like, you're being a hypocrite, Courtney, because you know what you're supposed to be doing and you're not doing it.
Yeah.
And how can you expect other people to tell other people to do this if you can't do it yourself?
Right.
So I try, like, I'm sure you can probably tell I'm a big thinker. And I'm a big, like, self-analyzer, and I'm a big, like, so, like, I'm really, like, self-aware with, like, stuff that's going on with me and, like, what I need to do to fix it and, like, how I need to address it, and, you know, and stuff like that. And because it wasn't always, I mean, I've not always been like this. I didn't get diagnosed with anxiety until I was in college. I always knew there was something like going on, but I didn't know what it was. And so then once I found that out, I was like, okay, I need to learn and address this and all of the stuff that, you know, like accompanies it. And so, like, I work really hard and I try to do like the self-care, and I try to like do all of the, you know, all the stuff like they tell you in school that, you know, you're like supposed to do, but it's just really frustrating because it never feels like it's enough.
Right.
And I don't know if I'm doing something wrong or if just like my anxiety's so severe that this is just kind of like my baseline, like constantly. But I mean, because I don't want to like pity party and be like, oh, my anxiety's so much worse than everybody else's. You know what I'm saying? Because like I don't want to.
Right.
But sometimes it really does, like, because I see other people with like an anxiety disorder, and maybe they just do a good job hiding it, and I just like.
Right.
But I'm like, I don't, they're not doing this. Why am I doing this and they're not doing this? And like, we have the same, like, I don't want to say issues, like in a derogatory way, but.
It's hard because you're trying to compare yourself to others.
Mm-hmm.
But, I mean, but everyone's experiences are unique,
mm-hmm.
which is hard.
Yeah, because I really struggle with feeling like a burden.
Oh.
I really struggle, so I compare myself a lot. And I'm like, well, if they can do it, then, you know, you should be able to suck it up and do it too.
Right.
So that's something that I really struggle with, is like with the anxiety and stuff. Because besides my husband, I don't really have a lot of people that I can. My husband, and then I have my aunt, you know, helps me a lot, but that's pretty much.
That's about it for your support system.
Yeah. I mean, my parents are really supportive, but they're not really supportive about the anxiety thing.
Okay.
Because they think it's kind of in my head. And they think that I should just be able to calm down.
Right.
Like.
But it's not that easy. No.
No. And the rest of my family just doesn't know. They don't know my medicine. They don't know.
That's tough.
Because it would be, well, are you suicidal? You know, da.
Right.
Like, not that there's anything like derogatory about that, but it's like, no, like I'm not, I don't want to kill myself. I don't want to, do like all these things. And then it's like, oh, well, you're not sick then.
You're not sick enough for their.
So then it's like, you're just trying to get attention.
Right.
So.
They just don't understand.
Yeah.
They have their own ideas on it.
Well, and they don't. Because, like, back home, like, mental illness isn't a thing. And, like, the fact that they recognize, like, being suicidal is bad is, like, a step in the right direction, honestly.
Right.
So, I mean, it's just not, it's not a big thing. And my parents, I guess, they understand. I guess they just don't want to, recognize because it's easier to like ignore it than to address it.
Right.
So, but
Seems like you have a lot of things going on in your
Yeah.
life.
yeah, I'm always like this. I mean, like this is like my norm. So I mean, I'm a little more stressed out and anxious than usual, but I mean, I usually have a lot of stuff going on, a lot of thoughts
Right.
going on, all the time.
Is there have you found any ways that you can sort of calm yourself down, or any self-care?
I
as you've done in
journal.
that? Right, you
I
mentioned
journal,
journal is
but it doesn't really help with the sleep. But sometimes it helps with like the anxiety. I have animals because I find my animals very therapeutic.
right.
And so like my German Shepherd in particular, she's a rescue. Like she's not trained or anything. But if I have a panic attack or I get really upset, she'll come lay her head on my chest, or she'll come lay with me and stuff. So like just petting her and like loving her like makes me feel a lot better because she just knows like
Right.
it's like because I have 4 dogs and the other 3 don't like
Right.
do that like she does. Like it's really weird because it's like you would think that she was like trained to do it, but she just like instinctually like does it.
She knows.
And so like I think that for me is really like therapeutic is, and I like podcasts and like true crime things. Like that's my thing too. I love true crime. So sometimes I'll read or like watch TV, but then sometimes I'm so anxious that like it's hard for me to focus on that.
Right, yeah.
So I'll clean and I'll like put a podcast on and I'll clean.
Right.
Because it makes me feel accomplished, which helps
Okay,
like
yeah.
alleviate some of the anxiety. Is like cleaning or like going to the grocery store and like doing things
Things.
like that are productive make
Right.
me feel accomplished, and sometimes that helps alleviate my anxiety.
So it seems like you always need to be productive. You need to be doing something, and you don't feel you don't give yourself the time to just like sit and
I see.
relax because it's hard. It's hard for you to get your mind to calm down enough.
Yeah, and honestly, I've got a lot better about it than I used to. Believe it or
That's good.
not, that's because my husband, when we first got engaged and moved in together, he worked night shift, and so I hated being alone, and I had to learn how to be alone. It was nothing but just coming home, eating something, taking a shower, going to bed. But I had to learn how to do that and how to be alone,
Right.
like with myself and with my
Right.
thoughts. So now, like, if he's at work or he's doing something, I can, like, take a nap or watch some TV or something for, like, an hour or 2. Like, if I'm having, like, a good mental health day,
Right.
like, I can do that without having to get up and
Move around.
yeah, I can't sit and do it all day, but
Right.
I can do it for like short increments of time, which is an improvement because I used
Right.
to I couldn't even do that. But if I'm not having a good day, then it's up and go and go and go and go because it
Right.
distracts me.
Right.
So
Have you ever tried knitting or something that you do with your hands?
I used to crochet
Mm-hmm.
and I just never got back into it. I started scrapbooking, but I'm not really artistic. So it's sitting on my counter.
Right.
Because I'm not creative and then I get frustrated because I'm like,
No.
this looks like crap.
Oh yeah.
So, but yeah, but yeah, I guess I think I like journal. I color. I also color when I get really anxious. That keeps me occupied. I'm like, I'll get like coloring books that have like inspirational quotes and stuff on them,
Mm-hmm.
which sounds like super cliche, but like, and
Yeah,
I'll
it's
like
something
post
you
them on
do.
the fridge and stuff. Like,
Right.
so I see it and I'm like, you got this. You colored that. Like, do you remember? Like,
Right. Yeah.
so I like try to hype myself up. So.
Right. Which is nice. It gives you something
Yeah.
positive, right?
Honestly, like, I'm really proud of myself because like I've come a long way like since I first like got diagnosed with like anxiety and like sleeping disorders and stuff. Like, so I mean, it's definitely getting better. Like, I have lots of
That's
things
good.
to be like thankful for because
Mhm.
like that's something too I have to make myself too is not like to catastrophize.
Mm-hmm.
I have to be like,
Right.
there are good things and you gotta like work on the good things. And
Focus on the good things. Take it one step at a time.
yeah, I just find it really therapeutic to talk Because once I get it all out, then it's like,
It's like,
mm-hmm,
right?
yeah,
You release some of that tension.
yeah. Because like my husband will come home and I'll just like verbal vomit at him for like an hour, and then I'm like, okay, I'm good, I'm
I feel
done.
better now.
Yeah, let's go watch some TV or something.
So do you think it would be beneficial to you if, maybe we met, like maybe once a week, and you can kind of just,
Maybe.
Maybe.
I've thought about getting a therapist before,
Mhm.
but I just don't want somebody that's gonna try to like fix me and like quote unquote, like try to like figure out my problems, because
Right.
like I feel like I kind of have a lot of that figured out. It
Right.
would just be nice to have somebody like
Mhm.
sit and listen.
Yeah.
Instead of like trying to cognitive behavior therapy me, or
Right.
like it's because it's like I feel like I do a pretty good job of being like self-aware.
right. You just
But-
need someone to listen,
Mhm.
a nice positive outlet.
Yeah,
for
and
you.
just validate my feelings. I guess that's the big thing.
Right. And we don't have to, we don't have to go with a diagnosis. We can just be here. We can
Yeah.
work on things that will just make your life better in the short term and the long term.
Yeah.
Set some short term goals, look towards the future. But other than that, I think we could do something.
Well, thank you.
Maybe we'll see you in a couple weeks.